Good morning, friends. Welcome to the next teaching session. We were discussing the riddles in medicine. And today's riddle is malignant otitis externa, also called temporal osteomyelitis, also called necrotizing external otitis. Now, it was about 7 years back when I was working in Delhi ENT multi-specialty hospital, when I was asked to examine and give appropriate treatment to a patient with diabetes mellitus with hypertension. You must be wondering what is special about this thing. We have been treating diabetes with hypertension before also, but why this case? Friends, this type of patient is rare to see for physicians because these patients go to the ENT department and therefore we do not see these ones. Though we might have read somewhere in the book, but there is only very small mention about this condition. The main complaint of these patients is the pain in the ear. This patient I am referring was about 65 years male who had diabetes and hypertension, and he had very severe excruciating pain in the left ear. He was given all anti-inflammatory and things, but pain was not relenting. So I made an attempt to control his diabetes and high blood pressure, but that did not benefit the patient. The ENT people have taken material from the granulation tissue, from the external auditory canal, and sent material for culture, and the bacteria grown were Pseudomonas aeruginosa. It was sensitive to 3 oral antibiotics, and knowing the gravity of the situation, I started all the 3 antibiotics together. This condition occurs in immunocompromised persons and is often initiated by self-inflicted injury or by iatrogenic trauma to the external auditory canal. Diagnosis requires a culture from the ear, and treatment consists of correction of the immunosuppression besides giving antibiotics. The important thing here is that the antibiotics have to be given for long duration, maybe for 2 to 3 months you have to give them. But the main problem of the patient is the pain which is not relieved till the bone. But the infection has gone to the bone, temporal bone, as I show you in this diagram. Now we will look at this diagram carefully. I keep it close to the screen so that you can see and make a note of it at later stage. You can stop the video and see this. If you look at it, you can see this is the pinna, that is the external ear, which you see like a big fan. This is the one. This ear has been pulled by our teachers number of times, and from the ear, this is the entry of the ear. This is called ear canal or external auditory canal. External auditory is for hearing. So this is the outside the ear, main ear apparatus. It is outside that. So from the pinna, the sounds are collected and they pass from here. So the infection is in this region. Now if you see it, this is the bone, this is the bone, this is the temporal bone, what we call. The infection from here has traveled to the bone, and when the infection travels to the bone, it becomes difficult to eradicate it, because in these regions the blood supply is very less, and therefore the concentration of antibiotics is not sufficient in this region. So we started all the 3 antibiotics together, to which the patient was sensitive, but his pain did not relieve. I then started carbamazepine, that is Tegretol, for the pain, but that also did not benefit the patient. Friends, remember there are two important nerves, cranial nerves, they run in this region. If I try to say, what is this? This is the 7th cranial nerve. This one. I put it my pencil here. This is the 7th cranial nerve, and this is the 9th cranial nerve. See this. This is the 9th cranial nerve, and this is the 7th cranial nerve. Facial nerve, and this nerve is 9th nerve is called glossopharyngeal. It is called glossopharyngeal nerve. Now, if these nerves gets involved, then it becomes a real problem for the patient. So, the main thing is that if you see a patient with pain in the ear, and if the patient is immunocompromised, immediately refer the patient to the ENT specialist for specific care. Do not take a chance of keeping the patient in your hand, because you will be facing a tough problem as we were facing in this case. So friends, I will again request you to like, comment and subscribe the channel, and do press the bell button. Friends, I send the link each time to as many people as possible. And most of my friends are very kind. They give thumbs up to this link on Messenger, but that is not the aim. The aim is to click the link that will open the video, and then like the video, and if you give a comment, that will be very heartening also, and that will improve our teaching sessions further. If you have not subscribed the channel, please do subscribe the channel, and if you want further information to come to you, then do press the bell button. Thank you very much. We will meet next time with another topic.